Hi, everybody. We're going to go ahead and get started. I want to welcome everybody to this ninth meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments here at the national headquarters in Lexington, Kentucky. Our focus today is on several state affiliates of the American Healthcare Association and the National Center for Assisted Living. AHCA and NCAL are the largest association in the United States, representing long-term and post-acute care providers with more than 14,000 member facilities. Their membership includes nonprofit and proprietary skilled nursing centers, assisted living communities, subacute centers, and homes for individuals with intellectual and developmental disabilities. In a moment, I will introduce Dana Ritchie, Associate Vice President of AHCA and NCAL, who will introduce you to the rest of our guests representing facilities in California, Florida, and Minnesota. From them, you will hear about an upskilling program for certified nursing assistants, training for nursing home administrators, efforts to bring young people into the caring professions, as well as a variety of interesting recruitment, retention, and messaging programs designed to address the unique workforce challenges in each of these states. We will take your questions later in the program, and we encourage you to make extensive use of the Q&A and chat functions here in Zoom throughout the program to converse with each other, share resources, and submit those questions and comments. And to our guests, feel free to take a peek and join the conversation in there when you are not speaking, if there is anything to respond to quickly or anything we should bring to the attention of the full group as we move along here. Please stick around until the end of the hour, and I'll have a few announcements about our upcoming activities. But first, just a quick recap of our project, as I do at the top of all these meetings. I know we've got a lot of new folks joining us this month. Welcome to you all. Last year, with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide, which you will find on the CSG website at csg.org. One of the 3 focus areas we had for the project was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies states have deployed to address those issues in recent years. We are pleased to again be working on this project with the Commonwealth Fund to build on the work we did last year. We've created this National Long-Term Care Workforce Network, an expanded version of last year's 8-state task force that now includes not only state policymakers, but a variety of subject matter experts, stakeholder groups, providers, and other partners. During a series of Zoom meetings like this one, we've highlighted initiatives to address the needs of not only those in direct care, but other subsets of the professional and non-professional workforce across different types of long-term care settings. We've been developing a new website, a national online resource center, where very soon you'll be able to view recordings of all of this year's meetings. We also hope it can become a clearinghouse for all the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website and link to. With this project, we also have the opportunity to provide on-site technical assistance services to states. If you believe policymakers in your state could benefit from a detailed briefing and action planning session on how they might move forward with policies to address long-term care workforce needs, please get in touch. We will be looking to make some state visits early next year as legislatures reconvene for their 2024 sessions. Even if you'd just like us to visit with you and your colleagues and have a conversation about what CSG might be able to facilitate in the future, we'd be happy to do that. Please reach out if there is interest in your state, particularly from legislators and/or executive branch agency officials. So without further ado, we want to dive into our main topic of this meeting. A while back, I reached out to Dana and her colleague, LaShawn Bethea, to detail what we've been trying to do with our project. I recognized very early on this year that we've had a growing list of folks from various AHCA and CAL state affiliates join us for these meetings. And even going back to last year, when Hawaii was one of our task force states, we had several folks from the Healthcare Association of Hawaii join us for meetings. And as I mentioned, we have an even larger group of state affiliate representatives with us today, thanks to Dana and LaShawn promoting the event. Dana gave me an opportunity to present to some of their state affiliates on one of their calls back in August. And today I'm excited that Dana and some of those affiliates are returning the favor, so to speak. Dana Ritchie is Associate Vice President of Workforce and Constituency Services at AHCA NCAL, where she has been on staff for just over 11 years. She's going to talk about some of the national workforce priorities and then introduce us to our other guests. Dana, take it away.
Great. Thank you so much, Sean. Appreciate that introduction. And I want to make sure to save plenty of time for the three state affiliate staffers that we have on. So I'm going to keep my presentation brief, but always available for questions. Sean, if you don't mind advancing to the next slide here, so we'll dive right in. I'm sure this comes as no surprise to anyone that's on the call. Our top priority at the association is focused around the minimum staffing proposal that CMS released. On November 6th, that was the comment deadline for this proposal. There was a 60-day comment period around it. There was about 47,000 comments that came in around it alone. We have expressed great concern and opposition to doing an unfunded mandate on, a staffing ratio at this time, as we are working to recover from the pandemic, and have dealt with significant workforce losses, and really instead focus on bolstering our long-term care workforce. The three state affiliate staff that I've had the privilege to work with and learn from are really going to dive into some areas in their states that they're focused on to help bolster the long-term care workforce as we idea share here. So this really is not the time to be putting something of this nature into play. We are very concerned, about closures that have happened across the country, limiting of admissions. And it's not just, the nursing home industry that's concerned on this. There is a wide array of other national organizations, associations, state associations that are very concerned on this front. And just to name a few, the American Hospital Association, has really been very public about concerns on backlog issues as they work to discharge patients, availability in SNFs, for receiving care. The National Rural Health Association has been very vocal. The National Association of State Veterans Homes very concerned, again, about what this proposal could mean for veterans' access to long-term care. There's a number of the religious affiliated based organizations and a number of the state associations have written in and wrote on this. So again, top priority, if you're interested in learning more about where we're at on this, our website, which I'm happy to put in the chat, has a number of our press statements, releases. You can also see the comment letter that we submitted around this. It was over 66 pages when I counted. So again, just, so you can see our philosophies, our thoughts on this. I encourage you to check that out. As part of some of these solutions here, again, to really help our long-term care workforce, one of the areas we're focused in on is the immigration side. PHI has noted that 1 in 4 of the direct care workforce are indeed immigrants. One bill that would help up on the Hill that was recently reintroduced about 2 or 3 weeks ago now is the Healthcare Workforce Resilience Act. It's a bipartisan, bicameral bill. It garnered significant support last Congress. And this Congress, it already has a number of original co-sponsors on it. Basically, what this bill does is it simply recaptures unused visas from previous fiscal years for nurses and doctors to be able to be utilized. We know right now that there is a backlog of foreign-born healthcare workers that would like to come to the States to work. Again, this bill would really help with some of that backlog issue in addressing that. So that's something we are strongly advocating for. Another bill is called the Ensuring Seniors Access to Quality Care. This is also a bipartisan, bicameral bill as well, too. What this does is this really helps to reinstate the CNA training programs. Basically, right now, facilities can lose their programs over a threshold of civil monetary penalties if it's hit. And this bill works hard. There's a few different kind of prongs approaches to making sure that they can reinstate these programs. Our CNAs are a critical part of our long-term care workforce. And this bill would, again, really make sure that, we can have these CNAs available. So the bill would allow nursing facilities to resume their in-house education program if a few areas are met. One, the facility has corrected the deficiency for which the civil monetary penalty was assessed. And again, I should note as well that this CMP amount could be imposed for a reason that did not reflect at all quality of care, harm to a resident or episode that reflects systematic problems. The bill also notes the deficiency for which the CMP was assessed did not result in immediate risk to patient safety and is not the result of patient harm resulting from abuse or neglect. And the facility has not received a repeat deficiency related to direct patient harm in the preceding 2-year period. It also gives Medicare and Medicaid providers access to the National Practitioner Data Bank for conducting background checks. So very solid bill. We've heard from a number of our states and providers on the importance of this. So that's something else we're advocating for. Also, there is a bill over on the House side that was introduced, the Building America's Healthcare Workforce Act. This bill focuses on retaining temporary nurse aides and helping them to become certified nurse aides. Specifically, it provides basically a reasonable grace period of 24 months to continue the emergency waivers after the end of the public health emergency, which obviously ended, to enable all temporary nurse aides who wish to the ability to transition to long-term roles. So these TNAs were a vital, part of our workforce over the course of the pandemic. That emergency waiver, again, obviously ended, and this is something we're really working to ensure that there is availability, so we again can have more CNAs here. Just lastly, on the apprenticeship side, there is a strong focus by the administration on apprenticeships. We've partnered with a national organization, Equus, to really encourage and promote long-term care apprenticeships. Some of our states have worked on these efforts very closely with us and have had successful CNA training programs with us. So that's an area we're very much focused in on as well. So that's kind of it in a nutshell. There's a lot going on workforce. It's a huge, huge priority at the association and will remain so. And again, I want to make sure that we have the opportunity here to hear from our next speakers. So I'm going to turn it over to Claire from California. I'll let her do a little bit of introduction of herself. And again, I've had the privilege to work with these three ladies and learn so much from them. So Claire, I'll turn it over to you.
Thank you, Dana. Hi, everyone. I'm Claire Enright. I'm with California Association of Health Facilities and run the Quality Care Health Foundation, the educational arm for the association. Just a little bit about background. I've been in long-term care for over 25 years. I've been a nurse for a lot longer than that and started out as an NA. So I have a little bit of insight. I wanted to give you just the groundwork of why we came up with this idea. It's not new. CNA upskilling, there's been a lot of thought and a lot of dry runs for it, but we realize that CNA is not an entry-level position. It is not worthy of minimum wages. We really need to embrace it and empower these individuals to be part of our care team. So that's kind of the ground level of where we started. Next slide, please. So we started with the idea of just some bare bones and a framework that would be easily adaptable and adoptable throughout our provider network in California. This is entirely employer-sponsored and recognized. There is no involvement from the California Department of Public Health or any other organization that would be eyeballing it and putting their own spin on it. It's a turnkey program. One thing I know about long-term care providers is they like redeveloping wheels, but this wheel we hope is intact and nobody has to mess with it. We don't want people to have to waste time messing with it. So it's easily adoptable. We've made it so that it's transferable and statewide, so that if a CNA goes from one employer to another, if they're both involved with the CUSP registry, then that CNA will be recognized at the level that they have attained, and they'll be hired on at that level wage rather than going back to the beginning, which frequently happens to CNAs. The idea is to really create a career pathway for CNAs within the career CNA, rather than having them be kind of in a dead-end job and thinking that the only way to grow is to get into another field, like, you know, go up the line into nursing, RN or LVN or nurse practitioner. We really, you know, we know if you've worked on the floor in a long-term care facility, you want to be surrounded with CNAs that have experience, that want to be there, that have the intention of staying for a while. A 5-year CNA is going to be able to do a lot more than a 6-month CNA. So this program rewards the employee for the length of service, the education attained, and the skill competency demonstrated, and hopefully gives them more and more skills as they progress through each level. Next slide, please. So CUSP, CNA Upskilling Program, we have our bare minimum criteria, realizing, of course, that providers, especially corporations, will adopt this and will add to it and put in their own criteria. But for a program to be adopted by an employer, they have to agree to this: a minimum of 6 months working at each level. They need to agree to provide the standardized, nationally recognized microeducation that we've provided. And we've done this by doing online education. It's self-paced. Our goal is to have each module to be able to be done between 10 and 15 hours, depending on which level you're at and how easily you learn. And that every level will have a return demonstration of skill competency, and that there will be someone on the ground at each facility in a supervisor training mode that understands what the program is, so that it perpetuates throughout the culture of the workplace, and that they, again, make sure that everybody is practicing at the bare minimum of each level. Next slide, please. So these are the career levels we came up with. CNA level 1 is the state approved CNA certification. In California, that's 160 hours of training, 60 hours of theory, and 100 hours of clinical. After 6 months of being on the floor, then they can move into level 2, which is a CNA preceptor program. This is an all-around team building program. Its 6-month mark is important because we know that when people have been in a position for 6 months and they've adjusted to their new skills, they think they have it all conquered, they kind of go into a boredom mode. This is a good time to lose people if we're not careful. So we've given them not necessarily a lot more to learn about how to be a CNA, but we've given them more about how to be a team player, how to move into leadership roles, how to support your fellow worker. It's just an all-around adaptability program. Level 3, this would be at 12 months, is RNA. Level 4, which we've divided into 2 at this point, is at the end of 18 months. Is that right? Yeah. And this is serious mental illness or advanced dementia training, depending on what the provider does. So a facility that has a secured unit for mental illness would definitely want to do the mental illness training. And if they have a lot of dementia folks, they'd want to do the advanced dementia training. My hope down the road is that we would have other trainings included at this level, and then advance to a level 5, which would possibly be either a geriatric specialty or prereqs for an LVN program. And if we could ever get them in California, hopefully a med tech program. A question that just came up is, what does RNA stand for? That is restorative nursing assistant. So it's a little bit advanced. It's not just your basic caregiving. It's what to do for someone that suffered through a stroke or has a lot of debility. It's a nursing program, not a therapy program. But putting splints on, making sure that somebody's room is set up in a therapeutic manner. it's just one of those leveling ups that will definitely bring value to their caregiving abilities. Next slide, please. We felt it was very important to reach out to educators that provide education on a national level and that we know have solid reputations. So we turned to the National Association of Healthcare Assistants for the preceptor course and the restorative nurse assistant course. And then we turned to Healthcare Interactive for the serious mental illness and the dementia training. Next slide, please. We also ensured that there was supervisor training. These individuals, licensed nurses, will take the course themselves and then also follow up with the skill competency and program oversight education. Most of these cases involve a manual and a webinar. So they do the basic learning plus a little bit of extra. And then all of this is available online. It's very important for it to be easily accessible. And next slide. The last piece of our program is that we've developed a registry. This includes an MOU, a memo of understanding that the employer signs. It guarantees that they will follow the education micro-credentialing that we have already established, and it assures that they will follow our basic requirements, our basic criteria, that they will agree to provide incremental wage increases, and that they will ensure that everybody that meets the established criteria will get to go into the next advanced course. They can't pick one or two with each session. They have to do each of them, anybody that meets the criteria. And then the next piece is that they pay a $30 fee to be put into the registry. That means that the CNA can always check back and get their level certificate if they lose it, and that a future employer can check in the registry to make sure that the person is in fact registered. There's a new question that just came up in the chat about how many facilities have executed an MOU. We have a couple of programs in California that I won't bore you with right now, but two different ways for programs, facilities to be involved with it. And at this time, we have six facilities that have signed MOUs that I'm aware of. That's because they're in our major programs. But we just had our annual convention, and we had an incredible amount of positive input. And I'm thinking that this will be adopted at some level throughout the state. We've got a couple of our bigger operational people, the folks that have over 50 to 100 facilities in the state, that are considering adopting it. So I'm pretty confident that we're going to have a good show. I'll be happy to come back and tell you more at a later date. Another question that just came up, is it safe to assume that $30 is paid by the employers? Yes, all aspects of this, the education, the wages during the education to the employer, being the student, and then the incremental wage increase and the registry fee is paid by the employer. We did not indicate how much that incremental wage increase needed to be. We don't feel that that's, the state association doesn't get to do that. But we did encourage it to be enough that the employee felt it and that it would be something to look forward to. So with that, I am done. If anybody has any questions, I'll be here until the end.
Great. And Kristen, I'll turn it right over to Kristen, who's from our Florida affiliate. Thank you, Claire, for that overview.
Okay. Hey, sorry, Dana, I didn't mean to interrupt. Thank you. Thank you for the opportunity to be with you all today. I'm Kristen Knapp. I'm the Senior Director of Strategy and Communications for Florida Healthcare Association. We represent about 80% of Florida's nursing centers, which is a little over 550 nursing centers. We have about 700 here in our state. And I wanted to talk to you today about kind of a broad range of the workforce initiatives that we have here in our state that we're working on, from supporting our certified nursing assistants and job opportunities and recruitment in that area, but all the way up to our administrators, because we know we are seeing a shortage of administrators now because the pandemic, so many of them retired. So if you can go to the next slide, Sean, just a kind of an overview of our state. We're a very large state like California. We have a huge baby boomer population, and there is a significant need. Healthcare is one of the largest industries in our state. And unfortunately, the number of vacancies that we're seeing between our nurses, our certified nursing assistants, RNs, LPNs is significant. We had just recently, this week, we had our Florida legislature convened a workshop to talk about the healthcare workforce shortages. And healthcare is it's the third fastest growing industry in Florida. And at the same time, the number of RNs by 2030 that we're going to need is over 50,000, over 4,000 LPNs. You can see since 2012, we had a 50% decline in the individuals testing to become a CNA. So as Dana, when she talked about the staffing mandate, it's very concerning for our facilities because we have such a huge population, over 300,000 individuals expected to move here in the next 10 years. And many of them will be over the age of 60 to 65 and need services. So if you can go to the next slide. So I wanted to share a couple of things that we've been working on. The first is our Caregivers Florida Career Program. This is a CMS, Centers for Medicare and Medicaid Services grant that we received. We're doing this in partnership with our state of Florida Agency for Healthcare Administration, which is our state regulatory agency for nursing centers. And those funds for this grant that we received came from what we call our Quality of Long-Term Care Improvement Trust Fund, which is basically the CMP monies. If you can go to the next slide, what we did was created a program that would help to recruit and retain certified nursing assistants. And we did that through two phases. Recruitment primarily was a very extensive outreach campaign, a very extensive media advertising, digital advertising campaign, trying to reach job seekers through social media, Google Performance Max, YouTube advertising, trying to attract new job seekers into the profession. We also had connected with our CNA training programs in our schools across the state. So recruitment was a big effort, trying to attract new job seekers, and then retention, working with our member facilities, our nursing centers, to help them with recruitment and retention strategies through educational webinars. We offered them free employee satisfaction surveys and just different tools that would enable them to maintain the staff that they had and attract new individuals as well. We used the Florida Care for the Aging website. We built that out. This is a website that our Indiana affiliate created initially, and there's many states across the country that are using that. We turned ours into a more expanded website where we could have our job seekers who saw our ads on social click through and wanted to learn more. They had the ability to do that by filling out a form and learning what participating facilities we had in the program. And then we would take those individuals and match them up with our buildings who had job vacancies. If you want to go to the next slide. So these forms would basically become profiles that our job seekers would complete, and we would submit them to our facilities every week. We had about 320 participating facilities in the program. So we did, so monthly they received a list of individuals who had expressed an interest. These were either individuals who already had their CNA certification, or they were individuals who may have had an interest in learning more about becoming a CNA. We built out the website so it almost had 2 tracks. You could learn more about with the questions and answers on, if you already had your certification. But then if you were interested in becoming a CNA, in Florida, we have a personal care attendant program. It's similar, I think, to the temporary nurse aid program. Our legislature made this permanent after the pandemic, where an individual can come into a nursing home, get training, and then work for up to 120 days of getting hands-on experience, which really helps them with challenging their CNA certification. So it's more of it's a learn while you earn type of program. So that was for those individuals who maybe weren't working in healthcare already, but wanted to learn more. We were connecting our job seekers with facilities that way. We have a free career center where we were having our facilities post their job openings, and again, making those connections. I mentioned the satisfaction surveys, the educational webinars, and then we gave all of our facilities a toolkit that gave them sample recruitment tools, advertising, creative assets that they could use to advertise their own job openings, messaging that they could use if they were talking to schools, for example, talking about working in long-term care and choosing a career. And we gave them, this is just an example of a leave behind that they were given that they could use if they were speaking at a job fair, for example. And they had the ability to customize these tools with their own company logo to make it a more personalized experience. So we're actually wrapping up the grant right now. And we went through and just looked at some of our analytics. We've had about almost 4,000 individuals that we were connecting with our member participating facilities. We don't have specific hiring data in terms of who hired, but those were the amount of individuals that we were able to send to our providers, and we kind of put it in their hands in terms of how many for them to take the next step for the interview phases. About 2,900 of those were CNAs, and about 815 were job seekers who were interested in becoming a CNA. So we really promoted the personal care attendant program to them. If you want to go to the next slide, I just wanted to highlight, these are a few legislative initiatives that our Florida legislature has passed over the last few years. I mentioned our personal care attendant program. That was a temporary program during the pandemic. And then in 2021, the legislature made that a permanent program. So now that PCA program, it's very active. Our providers find it very helpful, not just for recruiting new individuals who may want to get their foot in the door in healthcare. Gives them an opportunity to learn more about that. Sometimes it's not something that they want to do necessarily, but it's very expensive to challenge the CNA exam. So this is a good opportunity for someone to get some hands-on experience and really determine if this is a career for them or not. The linking to industry to nursing education, in 2022, our legislature added money into the budget to basically fund a collaborative partnerships between schools and healthcare providers. So LPN training programs, CNA training programs, the community college, the technical college could apply for a matching grant from the state to help offset funding for their CNA training program, as long as they entered into a partnership with a healthcare provider. So for example, Pines of Sarasota is one of our nursing centers. They have a CNA to LPN training program. Their CNAs are being trained by an educator at Suncoast Technical College, and that's being helped. The funding, it's free for the students, and the funding is coming from the line programs, helping to offset the cost of the instructor and helping to give those students an opportunity to upskill to go from CNA to LPN without having to pay tuition. So that's something that our state had continued again this past session. They've added some additional money into the budget, and we're waiting for that application process to open up again for the new year. Qualified medication aids were passed in this last session as well. So this is an experienced CNA who has the opportunity to receive additional training, and then they can become a QMA. This is great. We got a lot of great feedback from our nurses who are really, it's really retention and job satisfaction for our nurses who feel that they're so busy with passing meds that having some additional support would help them get back to doing their skilled experience in nursing. And at the same time, it gives CNAs with experience an opportunity to get additional training and have an additional responsibilities and an enhanced wage. So that was something that passed. We're actually in the middle of going through rulemaking, and that program will take effect where we'll be able to start training those QMAs probably early in the new year. Our Department of Health is going through rulemaking and just finalizing the curriculum to get that ready. And then I mentioned previously, still talking about workforce in the legislative session, our current Florida Senate president, healthcare workforce initiatives are one of her priorities. So just this week, we had one of our members testify on specifically to long-term care and the healthcare workforce challenges we are experiencing, and just offered some recommendations on some ways that we can help support bringing in new individuals and also upskilling individuals, whether that's, wraparound services, more streamlined pathways. We have a workforce development boards here in Florida, and they are all different. They're all structured different. Some have funding opportunities for incumbent worker training grants, but no region is consistent in how they determine who gets funded, how much funding they have. So, we talked a lot about those as opportunities to make it a little bit easier for both the job seeker and the providers to navigate these resources that are available to them. In terms of, and then if you can go to the next slide, in terms of, so that's a little bit about more the nursing or CNAs. These programs I'm going to talk about next are focused a little bit more on our long-term care administrators. So we have a Florida Leaders program. We're actually in our 16th year of doing this, and it's a leadership training program for individuals in Florida Healthcare Association in our membership. But the majority of them are nursing home administrators. They go through a 2-day on-site kickoff training really to develop their leadership skills. They learn about, making sure that they are engaging their team members. So workforce is a focus, continuous quality improvement is a focus. They learn about effective advocacy. And then once they complete the kickoff training on site, we have webinars that they go through throughout the year to just learn additional leadership training. We're actually getting ready to launch a mentorship program as part of this. So we've got, people that have gone through the program now. Actually, our current Florida Healthcare Association president, who's been working in long-term care for a while, she is a Florida Leader alumni, as are many members of our executive committee. But we're talking about getting these individuals who have been administrators for 5 or more years, who are Florida Leader alumni, becoming mentors to the newer administrators with 5 years or less, to really help them with what they need to know to be successful in this profession, both from a leadership, personal, professional leadership development, but even just, operating their building, giving them some mentoring. So that's something we're launching in the new year. We're really excited about. If you go to the next slide, this additional program that's part of this is our NHA 101 training. So this is something we started a couple of years ago because we really did hear from our newer administrators who just said, there's so much to know and it's so overwhelming. And how do I navigate doing this? So we started doing this as part of our annual conference, an NHA 101 training. As you can see, we usually have a sellout crowd. But part of that mentoring program that I mentioned previously, it will culminate at this NHA 101 training. So you'll get the one-on-one opportunity with your mentor, and then hopefully you'll be encouraged to come to our convention and be part of a 6-hour training where you can, again, learn more of these various focuses, financial, legal, regulatory, all the things that they have to, that they're exposed to. If you go to the next slide, we have a pretty robust administrator and training programs here in Florida. We have preceptors that are mentoring these AITs, but many of our AIT programs they are unpaid. So as an individual goes through to become an AIT, it's very expensive. You're trying to work a full-time job and maybe, or, work and become an AIT so you can be an administrator. So that's really challenging. So we have just established an AIT scholarship that will help fund. $1,500 is about what it takes just to pay to take the nursing home administrator exam. So we've launched a new AIT scholarship program. Again, we have our preceptor provider training. So we're connecting preceptors with AITs. And I really call it a matchmaking program. It's like we have a Facebook group and someone says, hey, I'm an AIT here in Orlando. Is anybody looking? And then we've got administrators chiming in. And we also have a dedicated staff member who is working to make those matches. And many of these individuals that have gone through the AIT, we're seeing them now. They actually were part of our advisory group that helped us with putting this scholarship concept together. So we're really excited to launch that. And we just actually received funding from one of our managed care companies to help with growing that scholarship even more. So we're excited. We do have additional scholarships. If we go to the next slide, additional scholarships that we offer to our long-term care employees. Our Bruce Taylor Scholarship is for employees who are looking to advance their nursing career. So CNA to LPN, RN, et cetera. And then we have what's called a Career Climb Scholarship. And that is really for folks that are working in the long-term care facilities, but not necessarily going to advance into nursing, but maybe they want to be a certified dietary manager. Maybe they want to be a physical therapist. That scholarship is available to them. We award those twice a year through our 501c3 foundation. And it's been really successful, and we've seen a lot of positive feedback from that. So in our foundation at fhcafoundation.org is where there's information on that as well. And then I just wanted to highlight a couple of things that we've been doing, some partnerships. If you'll go to the next slide, I feel like this has really been successful for us as an association to support our members, is branching out and building these strong partnerships. So I talked about Career Source, which is our local workforce development boards. We have a Career Source Florida, and then there's boards across the state. But they offer so many tremendous resources. Although they're not necessarily consistent, they can help our members with funding, incumbent worker training funding. They can help our members with posting jobs. They do job fairs. So there's a lot of opportunities for our members, but it's a matter of getting the information out there. So they're an active partner with us. We have them speak at a lot of our district meetings and provide a lot of resources there. They send us information that we push out all the time. Florida Department of Veterans Affairs and Veterans Florida, again, that's another opportunity for us to connect our members to veterans who are seeking jobs. We do a lot of outreach with them. We've got the Florida Association for Career and Technical Educators and Association of Florida Colleges. We're talking to them a lot about trying to get partnered with our members for CNA training, for clinical sites for CNA and LPN training programs. And then HOSA, Future Health Professionals. I can't stress enough, I talk to my members a lot about this. These are high school and middle school, basically after school clubs for students who are interested in healthcare careers. And we know that, there's such a tremendous challenge right now with our workforce, but there's short-term and there's long-term fixes. And, this is probably a long-term fix, right? We can't, a student in high school isn't necessarily going to be able to fill your nursing position today, but we really need to be educating our young adults about the opportunities to work in long-term care. And we work with our HOSA state conference. We sponsor that. We have a booth, and then we work with the local HOSA clubs around the state, and we send our members. They go out, they make presentations, they provide, they do mock interviews for them. They have regional conferences, so they are involved in that. It's really rewarding for our members because they love to talk about their careers and they love to talk to these students. And I think it's really a great opportunity to help them understand the many pathways that long-term care has to offer. It's not just long-term care administration. You might want to work in, admissions and marketing. So we use the Florida Care for the Aging website that I mentioned earlier. It has a broad overview of all the careers in long-term care. So it's a really good resource for these students when they want to learn about the many opportunities that there are. And then in the next slide, we have student memberships as well. So for $25, you join FHCA as a student, and then you get all of our resources, and you can, our regular communications. You can come to our district meetings and network. So this is really more focused on the, maybe the college students, the technical colleges who are they're more apt to join this. That is a requirement of our AIT scholarship, is that they are a student member. But most of our preceptors are members as well, so they usually sponsor that membership for them. And the last thing I'll just mention, this is kind of just a recap, just our two on the next slide. These are our two websites that we use. Again, careers.fhca.org is our job board, our career center. We allow our facilities to post their job openings for free, and then job seekers can post their resumes and look for job openings. And then the Florida Care for the Aging, which is really a great tool that, again, it's a great overview that talks about all the different career opportunities. So with that, I'll wrap it up, and I'm happy to answer any questions, or I can answer in the chat. So thanks for the opportunity.
Kristen, thank you. And there was a nice comment here. These are great tools, develop strong leaders, very impressive and well done, Florida. Nice comment there. Claire put in the CUSP information here for more information on that. She put that in the webinar chat, and hopefully, Sean, everybody can see that. I don't know if that just went to, okay, perfect. If the panelists are, okay, very good. And then I think all the rest of the questions were answered here. Oh, and I do see this too, Kristen. Do mentors in the mentorship program receive any compensation, both admin and NHA 101? But I think you got into that a little bit. I'll turn it to you.
Yeah, we don't have compensation. So if as a mentee, to encourage mentees to participate, we're going to offer them a discounted registration for the NHA 101. For our mentors, we're doing this through our Florida Leaders program, so they won't be compensated, but they're already actively engaged. Many of our alumni, we have over 200 Florida Leader alumni because we've been doing the program for 16 years. And as I mentioned, all the way from basically our entire executive committee on our board is a Florida Leader, and most of our board members are Florida Leaders. So they're already active and involved in our association, and, individuals that are very strongly believe in giving back to the profession. So I don't expect that we'll have to compensate them, but they, I think this is something that we've talked about. We've been talking about it for a while, that they want to be actively involved, and we need to recruit more leaders. So we're trying to make it easy on them. We're facilitating webinars as part of the mentorship program. So we encourage them to communicate with each other, but we're also offering an opportunity for them to come together on a webinar that we host on leadership, so that, that gives them a few additional ways to connect when they don't have to do it themselves. So the easier we can make it on them, we find it to be the most successful.
Great. Thank you, Kristen. Really appreciate that overview. Great work happening in Florida as well here. And I'm going to turn it over to Nicole to make sure we have an opportunity for the update from her as well. So Nicole from Minnesota, turn it to you.
Thanks, Dana, and thanks for having me. I'm Nicole Matson, Vice President of Strategic Initiatives with Care Providers in Minnesota. And as a way of background, I too am a nursing home administrator, have worked in long-term care. I always say I grew up in long-term care because I started as a dietary aide and progressed on through the career ladder, and I'm fortunate enough to advocate for the profession at our state association right now. You can go to the next slide. So wanted to give just a little bit of context, a real high level picture of our labor force strains in Minnesota. So if you can go to the next slide here. I borrowed liberally from our State Department of Employment and Economic Development feed, but you can see that we have really extremely low unemployment. We've been at under 3% for the past 24 consecutive months. It's not on this slide, but we also have a really high labor force participation rate. We run at about 68%, which is above the national average. And this is a point in time when you don't necessarily want to be above. You don't want to be excelling when there's such a large gap. You can see on the graph here between the green and the blue, that gap has just been increasing between the number of unemployed and the number of job vacancies. So right now, there are 0.4 job seekers for every one job opening. So even if all the unemployed people took 2 full-time jobs, it still wouldn't be enough. This is just a very competitive market. If you can go to the next slide. And you can see on this next slide, when you disaggregate the data and look at healthcare and healthcare support together, which is the sector that long-term care is in, that darker blue quarter, that's us. Our job openings far outnumber any other sector. Minnesota Public Radio ran an article yesterday, and it was titled "Desperately Shorthanded." And it highlighted the adaptations that businesses were leveraging to account for the lack of workers. It was really focusing on food service and changes to hours, days of operation, types of service delivery, et cetera. But these just aren't strategies that we can use in healthcare or in long-term care. If you can go to the next slide. So all of this is, oh, well, I can't, oh, there's the data chart. Thank you. So all of this is occurring while demand for our services is growing really exponentially. I know those numbers are very, very small, but what it's highlighting is that occupational growth is going to be led by our sector. We have the largest projected increase, and these data points are really capturing the attention of legislators and state agency stakeholders. They see that there is some urgency and a need for sector-based workforce solutions. So let's talk about some of those solutions. You want to go to the next slide and the next one. So one solution is a grant that we received from our Department of Health, which was made possible through the Centers for Disease Control CDC funds that they received. We're fortunate to work really closely with our Department of Health and did so even more during the pandemic. And I think as they started to stand up these kind of emergency-based staffing solutions, they became acutely aware of some of our barriers. They saw firsthand how disadvantaged we were in the labor market. We, as long-term care employers, do not have recruiters or deep benches of HR that we can deploy into the community. And we've kind of had years of being marginalized in the healthcare sector, not really being able to compete on things like wages with our higher resource entities like acute care. So I think it was really easy for the health department to see the value in allocating funds to long-term care workforce. So they included that in their initial proposal, but initially what they wanted to do was create a mentorship program. Not that there isn't value in a mentorship program, but what we really made the case for is we have to have staff to mentor, right? That's kind of the first piece of the puzzle. If there's no one there to mentor, it's not going to be successful. So we just made the case to look at it differently, that we needed to really recruit new people. And I think Kristen said this as well. We needed to recruit new people into the profession if we were going to be a viable entity going forward. So they did an RFP process, and we applied along with our other long-term care association and the state leading age, and were awarded a grant, an initial grant of $409,000. And then we had some subsequent dollars that were added for an employer matching system. And our proposal was to leverage a professional communications entity to really lean into that expertise to help us build out a website and create this public relations campaign. Somewhat similar to what Kristen was saying, but we really wanted to leverage outside expertise. I think the health department could see the value in that with our RFP, because we made mention of their successes with testing and vaccination campaigns that they ran. So we wanted to revamp an existing website. It already exists, and please don't go to it because it's not in any great shape or form. We're really going to update it. Do some branding and do this statewide public relations campaign using a variety of different communications channels. We also wanted to make sure that the project was informed with a worker voice, that we incorporated their perspectives. So we developed this caregiver advisory group comprised of caregivers from throughout the state, both metro and rural, lots of different positions, so that there was good representation. And then because the health department kind of pivoted with their initial thought, they decided that we would be serving as a hub for an entire workforce capacity building project. So they actually, oh, there's my light, sorry. They actually funded some other projects as part of the initiative, which are a much smaller scale, but maybe some similar work. Some work is completely different, but all would benefit from the elevation of the profession and the campaign that we intend to do. So if you can go to the next slide. And I'm going to talk fast. Don't worry, you're going to get out of here. It's Friday. So we wanted to build out this existing website, make it a one-stop shop, make it the authority on all things related to long-term care, have something that we could disseminate out to a variety of stakeholders, notably workforce development, educators, job seekers on the whole, so that there was this industry-informed tool that they could leverage to talk to them about all things related to careers in our profession. What are the career pathways? What do they look like? What is there to support, through scholarships? Who's hiring? What employers are in their area and how do they connect with them? And that's really what that last piece is, that employer match system isn't intended to be a job board. It's really intended to kind of flip the switch and move our employers into more of a sales role. So once they get a lead, meaning a prospective employee that's interested in working for them, it's up to them to follow up on that lead. And I think it kind of fits, it's more in tune with where job seekers are at. They're interested in working for someone that aligns with their values, and this matching system will allow them to search and kind of make those connections based on who fits with their needs. So if you go to the next slide, this is just really about messaging. We know if we're going to be successful in this market, we're essentially going to be stealing people from other professions or enticing them off of the sidelines. So making meaningful moves, I think I really like that message. And also really messaging, what is it about us that is unique, that is different? There's a lot of advantages to working in long-term care that we don't often get to sell. But also workers want to know what's in it for me. What do I get out of this? So often in healthcare, we're trying to leverage that you're doing something for someone else, which is part of it. But there's really a lot that you take away from a career in long-term care as well. So the next slide, you can just kind of see some of the branding, color palette. We are looking forward to going live with the website in the first quarter of 2024 and launching that media campaign, incorporating some of those worker voices, and really having this tool and this campaign in alignment to try to sell job seekers on our profession. So I just wanted to highlight real quick, I will talk fast, some other initiatives. If you go to the next slide, we were really successful with this very simplistic initiative this past legislative session, and that was to incentivize students to enter into a caring profession, kind of sweeten the deal. Students can get up to 1 elective credit for every 350 hours that they work. These are high school juniors and seniors, up to 2 credits per academic year. There's some back and forth that needs to take place as far as verifying their hours. And if you go to the next slide, I just wanted to put in here kind of how we sold it. I will say that this was a feel-good moment at the legislature, both high interest from Republicans and Democrats, because everybody wants to solve the workforce crisis. Everybody sees value in kids entering into the profession. And I really think that this is a talking point for our employers to start talking with young people about how careers in our sector can be foundational for any career aspiration. You can start with us, you don't have to end with us, but starting with us has a lot of value, and it now includes elective high school credit. And then the last couple of slides, I just included a couple of state agency initiatives. One is through our Office of Higher Ed, building out no barrier nursing assistant training. They've had a lot of success putting a lot of students through this. I think eliminating cost is a good thing for potential nursing assistants. We want to see a greater connection to employment, and this next go around that they're currently in does have an emphasis on employment. Just building the nursing assistant component of it, passing the test, that's one thing. We just want to see those individuals working for us in our sector. And then lastly is our Department of Employment and Economic Development focus on some of the 5 most critical sectors in the state. Sorry for my light, of which the caring professions is one. So I just put that in there to highlight that they too are getting quite concerned with the numbers. Data is really impactful, and they see that we are behind and continue to be behind in the number of employees in the sector, and that doesn't bode well for our future. So they want to be about solutions that are driven from industry, and that's what this is. I told you I'd talk fast.
Nicole, thank you so much. So Sean, here's all of our contact information as well. Just wanted to make sure folks had access to that. If you have any questions whatsoever for us, please do reach out. Appreciate everybody taking time the week before Thanksgiving as well, and on a Friday later afternoon too, to join here. You know, some great information shared by 3 amazing state affiliate staff. Sean, I'm going to turn it back to you.
Dana, thank you so much, and thanks to Claire and Kristen and Nicole as well. We have just a couple of minutes we'll take here at the end in case there are any last-minute questions that folks can answer. Is there anything we've seen in the chat or the Q&A there that rise to the level of the full group here, or?
One interesting thing for those that can stay on, somebody said, has anyone looked at, Shirley did, has anyone looked at older retired healthcare workers to return to workforce, jobs that can be modified? Nicole, Kristen, Claire, any thoughts on that? Yeah, Nicole?
Yeah, our state has a reasonable accommodation fund through the Department of Employment and Economic Development. They're standing up grants, and any employer, small to medium-sized employer, can apply for these grants, but the intent is to offset the costs that an employer would have to make an accommodation. You know, there's some other initiatives behind the scenes that are really trying to get disabled folks back into the workforce. They have a much higher rate of unemployment than other demographics. But the accommodation fund is pretty tactical in that it's cash. It's actual money that you could use for computer equipment, you know, other type of technology that could support someone's accommodation.
Great. And then I think a question came up. Thanks, Nicole. Can you please attach Minnesota's slideshow? And this is being recorded. So I know, Sean, you're sending everything out post. So
I will. Yeah. Anybody who is registered for this or who is on our mailing list will get a copy of the slides as well as a link to the recording afterwards.
Sean, I think we hit all the questions I'm seeing in the chat.
Okay. Great. Well, I think we are at the end of our time here today, and I want to once again thank all of our panelists for joining us. And Dana, thanks so much for your coordination and for putting this all together. A couple of quick notes before we go. We are gearing up for the CSG National Conference, which will take place December 6th to the 9th in Raleigh, North Carolina. We're planning to highlight the work of the National Long-Term Care Workforce Network during a session on December 7th. We'll have a few folks you may recognize from past meetings of this network joining us for that session, including April Young from Advancing States and Alice Bonner, Betsy White, and Kezia Scales from the Moving Forward Coalition. We'll also be joined by Amy Ford, who is co-directing a National Council on Aging project to develop a direct care workforce strategy center. Plenty of other great sessions to explore as well in Raleigh, so we hope a few of you can join us for that. If you or a colleague is currently not on our mailing list but would like to be, please reach out. And as I said, we will share the slides from our speakers today, as well as a link to a recording of today's meeting to everyone on the mailing list and anyone registered for this meeting. So be on the lookout for that. We also expect to have an announcement very soon about the launch of our new National Online Resource Center. Please send us your relevant bills, reports, resources, articles, and initiatives so we can populate the website with details about what is going on in your states regarding the long-term care workforce. And as I mentioned, you will also be able to access recordings of all of our network meetings on there eventually. If you would like to request an on-site technical assistance action planning event, or perhaps just a visit time to your legislative session early next year, please get in touch. We can also provide more information on who is eligible to request those services and what those site visit events might look like. Also happy to talk about new ways to partner on long-term care workforce issues in the future. And finally, I just wanted to say thank you. And we expect this to be our last Zoom meeting for 2023. And at this point, we're not sure what shape future meetings of the network might take. We are reaching the end of our current project cycle as currently defined. We will be having conversations in the coming weeks about the best way to continue our work in the long-term care workforce space. So if you have found this meeting or others that we've done valuable, please let us know. If I don't have a chance to talk with you again before the end of the year, please accept my best wishes for a happy holiday season on behalf of CSG. Thanks so much again for joining us today and participating in the discussion. We hope to see everybody sometime down the road. So long from Lexington.
Thanks, Sean.
Thanks.